All right, so background. We have Mr. Devin Jones coming to us as a patient. He's a 40-year-old African-American male with a long history of uncontrolled hypertension. Both of his parents ended up dying from this. His mother also had type 2 diabetes. He works as a police officer in a high-crime neighborhood and quit smoking about 5 years ago when he was initially diagnosed with this. Additionally, he drinks several beers a day and also doesn't really watch his diet that much. So unsure of how much sodium, fat, and carbohydrates he's taken in. Doesn't exercise frequently, has had a 20-pound weight gain inside the last year, and has some dyspnea with exertion. Metrics that we need to meet: explain primary, secondary, and complicated hypertension in layman's terms, go over some of his risk factors with him, and discuss one pathologic effect of complicated primary hypertension. Let's get into it. So, hypertension itself is a medical term that's used to describe high blood pressure. The cardiac system has two primary components, electrical and plumbing. And hypertension or high blood pressure is going to follow underneath the plumbing component of everything. There's a couple of different subcategories of high blood pressure itself: primary, secondary, and complicated, also known as malignant. Before we get into those, let's discuss what blood pressure is exactly. It is made up out of cardiac output and systemic vascular resistance. Cardiac output itself is your heart rate times your stroke volume. So how many times is your heartbeat in a minute? And then how much blood is your heart pumping through with each heartbeat? And then how much pressure is going through your pulmonary system. So the way that we can kind of think of systemic vascular resistance is almost like a garden hose. High systemic vascular resistance is akin to a garden hose that has a lot of water pressure. It's shooting that water through at a jet. Low systemic vascular resistance is kind of where that water is coming out at a trickle. And then the combination of both of those makes up your blood pressure itself. An official diagnosis for hypertension is a systolic or top number that is greater than 133 millimeters of mercury, and then a diastolic number that's greater than 80 millimeters of mercury. So primary hypertension itself doesn't really have any kind of identifiable cause. This subcategory is most prevalent and accounts for about 95% of cases, and it frequently develops over years. This is what our patient has. Secondary hypertension develops rapidly and unexpectedly, and it's often like a cause of some other kind of condition going on. Typical things that would cause this would be like byproducts of renal disease, congenital heart defects, endocrine disorders, adrenal gland disorders, side effects of like certain medications or street drugs. Example, I do a whole bunch of cocaine, heart rate shoots up, that's going to raise my blood pressure too. And then complicated hypertension, also known as malignant hypertension, occurs from end organ damage or a hypertensive crisis. This is defined as a blood pressure that's greater than 180 millimeters of mercury for a systolic reading, and then the diastolic would be greater than 120 millimeters of mercury. This can often result from some of things like renal, endocrine, or central nervous disorders. So, Mr. Jones as an individual, he has some very significant risk factors for high blood pressure. The following risk factors would include his predisposition to having this because he's an African-American male, a familial history of mortality from high blood pressure, weight gain, stress, excessive alcohol use, along with a questionable diet. Diving into these risk factors a little bit more, Black men in particular are at a higher risk of developing high blood pressure with mortality, and his family history also serves as an excellent example of this. Having two relatives pass away from complications is concerning in and of itself. Weight gain and alcohol increase excessive strain on the heart. Consuming too much fat or carbohydrates increases obesity, and then having some dietary issues like excess sodium can increase fluid retention. If you're carrying around more adipose and you're carrying around more fluid, your heart has to work harder to pump blood throughout your body. And then the other concerning thing too would be stress. Your endocrine system doesn't like having to release a whole bunch of hormones, in particular cortisol. Your body's essentially existing in a fight or flight response, and Mr. Jones in particular is suffering from this, especially working as a police officer in an area with a high crime rate. Over time, this will have a cumulative effect and can damage his cardiac system. The good news is there are ways to reduce blood pressure. He has several modifiable risk factors, meaning things that he is directly able to change. Prime examples of these would be weight, diet, alcohol consumption, and stress levels. By improving these, it's possible to lower blood pressure and then have a longer quality of life. And then the significant health effect that we're going to explore is stroke or cerebrovascular accident. So high blood pressure does a couple of different things. It can cause atherosclerosis or plaque buildup, and it can also cause aneurysms or functionally like weakening and dilation of the blood vessels themselves. This ultimately leads to roughly two different kinds of strokes. You have ischemic and hemorrhagic. Ischemic is where the brain is deprived of oxygenated blood. Typically, this results when atherosclerosis or plaque breaks off and it ends up going to a vein or artery that supplies the blood with oxygen, that supplies the brain with oxygenated blood. It blocks it, that oxygen no longer flows, you have necrosis of that brain tissue, or like your brain tissue literally starts dying because it can't breathe. And then the second kind of stroke would be a hemorrhagic stroke. So this is related to hypertension itself. Those blood vessels are underneath high pressure. Think our garden hose with that jet coming out, right? And you can only do that so long. That blood vessel ends up breaking, boom, you have blood going on to the brain, which is not good at all. Blood on the brain is actually toxic and it can cause tissue death. There's a couple different kinds of bleeds. If this is a large blood vessel that breaks, the blood can actually build up in the cranial vault and it can cause brain herniation where it goes to the opening at the base of the skull, and then that ultimately kills someone. So obviously hypertension, not good, causes serious neurological defects, and one of the best ways that we can prevent that is by focusing on our modifiable risk factors. So if Mr. Jones was my patient, my recommendations would be, okay, let's go ahead, let's get some blood pressure readings and let's see where we are. We can go ahead and discuss modifiable risk factors. I would love to try and change those. That way we don't have to start medication. If that doesn't work, biggest concern is, okay, we have to go ahead, we have to get that blood pressure down so you're not worrying about stroke, CVA, or like other complications from cardiac disease. All right, that is it, guys. Please feel free to ask any questions you have. Thank you so much.